Welcome to One Brooklyn, presented by Brooklyn Borough President Eric Adams. Brooklyn Borough President Adams joined with the Brooklyn Hospital Center to unveil a new on-site tent facility to pre-screen patients who believe they may have contracted the novel coronavirus and to determine if they need to be tested for the sickness. The facility will help relieve overcrowding in emergency rooms and allow healthcare facilities to allocate finite resources such as testing services more effectively. Borough President Adams called for this kind of facility to be replicated by hospitals throughout the city to help contain the spread of coronavirus and also to address ongoing critical health care needs separate from the coronavirus. People who are concerned they may have contracted the virus will be able to enter the tent in the front of the emergency room and be screened by trained medical professionals using tools such as remote thermometers. Those that are experiencing severe symptoms such as respiratory distress will be directed to the ER, while those that are experiencing mild symptoms or who aren't experiencing symptoms consistent with the disease will be encouraged to self-quarantine out of an abundance of caution.
Thank you so much. I am Brooklyn Borough President Eric Adams, and I cannot say enough about this team here at Brooklyn Hospital. Gary, who's the head of the hospital, longtime friend, and really just innovative in his thoughts of how not only how we deal with crises, but how we deal with everyday health issues in the borough. And Lenny and I have been on the phone and just constantly analyzing how do we move forward and deal with this coronavirus crisis that we're dealing with. And so really, Brooklyn Hospital, your team, all of you for just facing this crisis head on. And this is only one of many things that you're going to find out in the next few days that Brooklyn Hospital is doing to just really change how we deal with the issue around coronavirus. The number one concern that we are receiving from the public in the Borough President's office is the confusion, the lack of communication, the lack of free-flowing information. And I'm calling on my state, city-wide elective, borough-wide, all of my local officials. We have to stop writing our own book and get on one book and one page. This is not a one-up show right now during the crisis. We all need to be standing together. Whatever previous conflicts we may have had, we need to put it behind us, and we need to get through this. We owe it to the American public and the public of New York City. And that is so important that we do so. And I'm hoping that all hospitals in this city, in H&H and private, follow what Brooklyn Hospital is doing today in this announcement and some of the announcements that they're doing in the future. The numbers speaks for themselves. Currently, we have 644 confirmed cases of coronavirus in New York City. 19% hospitalization rate statewide. Today, we're here to unveil a new pre-screening facility at this Brooklyn Hospital Center. It's so important to be able to pre-screen so that people are not overtaxing our hospital center. The tent that we see behind us, we're going to do a walkthrough, is going to be fully operational tomorrow, Wednesday, March 18th. People who are concerned, they will be able to come here if they're concerned that they have contracted coronavirus. Every cough is not coronavirus. Every sniffle is not coronavirus. Every headache is not coronavirus. And we have to be able to separate those who are dealing with allergies, flu-like symptoms, colds, asthma. We have to separate them for the population that is in higher need, and that's what Brooklyn Hospital is attempting to do. Those who are exhibiting severe symptoms, such as respiratory distress, will be directed to the ER. The tent is connected to the ER. You can walk right into the ER. It's a great layout and it serves a great purpose. Those who are experiencing mild symptoms or aren't experiencing symptoms will be encouraged to self-quarantine. That is the best way to do it, self-quarantine. Self-quarantine does not mean have your own hospital room to occupy space. It's in your home. the best way to deal with this issue is to remain home as much as possible if you don't have to go out and you're not part of the necessary personnel to run this city and to handle this crisis. This new facility that is being rolled out will help alleviate overcrowding in the ER, allow medical professionals to provide care to those with the highest level of need. Public health experts is telling us that we need to flatten the curve. What that means is that coronavirus cases are rising at a high level. In order to avoid overwhelming our hospitals, we have to implement social distancing and other measures that stop the rapid rise of new cases. Facilities like the one behind us will help us do that, and we need to clearly understand this is the method and how we could handle this crisis that we're facing. My office has identified the several public sites throughout the borough because we know we're in need of hospital beds and we may have a potential increase in that need, and we're looking at places such as the Brooklyn House of Detention in downtown Brooklyn, DOE buildings on Livingston Street, armories on Bedford-Stuyvesant, Crown Heights, and Williamsburg, a Brooklyn cruise terminal. We know the cruise industry has slowed down. It's a large space. It's a Brooklyn cruise terminal that could be used as a hospital space. Floyd Bennett Field, the Aviator Center there is a large space. You can also place heated tents for it as well. So we are adding our voice to how do we deal with the hospital bed crises that we may and potentially will face. What our spaces in Brooklyn, there are spaces in Brooklyn that can be used for the overflow, can be used for testing capacity, and we also believe it can be a place where we can quarantine when is needed. We also think it's important that consumers and those who have shops and stores, we continue to put out the message of not to price gouge, not to raise the cost of the basic things that are needed, to continue to make sure our hospitals have the basic supplies. We will collapse our healthcare system if our hospitals and employees don't have self-protected gear. And so we cannot hoard these items. They must flow into our hospitals so our hospitals can continue to do the amazing job that they have carried out throughout this entire period of time. And we cannot thank them enough as they have put their personal safety on the line to make sure that we bring this virus under control. And so I want to turn it over again to Gary. He's the president and CEO of the Brooklyn Hospital Center, and I cannot thank him enough for what he and his team is attempting to do to turn back the apprehension, the fear, the anxiety, the uncertainty of the need to deal with those cases that are higher in need to deal with. Gary?
Thank you, Borough President. I'm sorry. Gary Terrinoni. Good luck on the spelling. No. So first of all, I'd like to welcome and acknowledge the Borough President Eric Adams here today. He has definitely showed the leadership skills and support to get what we need here at the hospital. In fact, he had a meeting last week with the CEOs in the borough just for that reason, just to ask us what our needs were and reacting very effectively on those needs. So in fact, one of those things we asked for is a little bit of support from the NYPD, which they and the Borough President were happy to provide. So we're very thankful for that. As you can see, and the Borough President talked about, we have a tent behind us, which is not a novel idea, but we do think it is better to protect our patients and the staff here at the hospital. So I think the Borough President will walk through that today. We want you to know that Brooklyn Hospital is here to stay. Actually, we're very honored to report this is our 175th year of operation. We're one of the oldest hospitals in the New York City marketplace, and we will get through these trying times. I'd like to acknowledge the staff at the Brooklyn Hospital Center because it's amazing. The doctors, the nurses, the support staff, they literally have been working almost 24 hours around the clock. I see people yawning and so forth. It's just amazing. What was normal probably 3 weeks ago is not normal to us today. So that's what we're dealing with today. I do want to say also, from a media perspective, we do have a website here at the Brooklyn Hospital Center, and we are putting out updates to the virus on a daily basis as we get feedback from the regulatory bodies and so forth. So you have that. We're also publishing on our social media, and you will see information there, including tips of how to keep yourself and your family safe. Some of those tips are, right, you want to wash your hands all the time, and I find myself doing that even more than I would do before. And then the social distancing, just make sure that you keep a nice distance from the people around you. So I think those would be two things to remember. So with that said, I would like to just again thank the Borough President. I think he's really demonstrated the leadership skills that you need in these kinds of times. These are different times, and we need to think very differently. So I'd like to thank him for that, and look forward. We'll get through this crisis working together, and these are the types of leaders that we need. And hopefully we learn from this crisis. But we'll get through it. Be confident we will, hopefully sooner than later, and then we'll learn from it, and then the next time around we'll be better prepared. So I'd like to thank the Borough President for your comments today. Thank you.
I think we have someone from Hakeem Jeffrey's office is here. Okay, we have been communicating with our congressional delegation as well, so we're open to any questions before doing a quick walkthrough in the tent area. Yes. Doctor.
Sorry.
Treatment.
For pre-screening, we would bill as a normal. What a hospital would do is if a patient comes into the ED, we would bill them like any other ED patient.
Mr. Adams, it's great that people are going out and do it. What exactly is happening here that patients can't do on their own? Take their own temperature, decide if their symptoms are severe.
And that's a great question. What we are encouraging everyone, the tools kits. What are the tool kits you need? Thermometer, handheld, or whichever way you want to do it. The more information you arm the doctors with, the better they can do that pre-screening. And they can do it on their own. But there's a body of people who feel comfortable in sitting down talking to a healthcare professional. And for those, we don't want them to overcrowd the emergency room. We want to do the pre-screening. And so we encourage people to stay home, use a thermometer, take your actual temperature. And we're going to talk about in the next couple of days the build out of telemedicine, which I can't understand why we're not using it more, and we're going to show how to do so, let people talk one-on-one with their doctors. So yes, this could be done at home at a pre-screening level, but those who are not doing that at home and they are coming to hospitals, we don't want them overtaxing the emergency rooms. We have been in communication with privately owned locations as well. We didn't want to announce their locations until we are able to have it solidified. We want the city to go do inspections and see if it's the right place. But we believe there are a number of private owned sites and a number of private owned real estate owners have reached out to our office and stated, you can use our space. We have hotels locations that are available as well as private owned locations, and we are in communication with them as well. Combination, we're going to need sites. We're going to need sites for hospital beds. We're going to need sites to house those who are coming into the city. The mayor put out a call for other locales to have healthcare professionals come. We're going to need sites for them. And so now it's time for us to come together with corporate and community partnership and public partnership to identify all of these different locations and be able to house those professionals and be able to have the emergency hospital beds that we need.
Go ahead.
How many patients?
Sylvia, do you want to
Sure,
say who you are?
sure. My name's Sylvie de Souza. I'm the chair of emergency medicine at the Brooklyn Hospital Center. Yes, it's Sylvie. Last name is de Souza, Desouza. So to respond to your questions, the hours of operations will be 8 to midnight daily. We also will be able to see as many as, currently we're seeing about approximately 100 patients a day with those specific symptoms that are of concern. So this will allow us to decompress the influx of patients in the emergency department, to screen, to identify, to send home for isolation with proper instructions, and to test those who fit the criteria for testing. Because testing has been a challenge as well, as you know, in New York City in a general manner. Pardon? We do for those who meet the criteria. Yes, we do test. It's on a day-to-day basis. Our stock is assessed on a day-to-day basis. But so far, we've been able to test everyone who's met criteria.
Oh, wait, come on, let's do some order. Mm-hmm.
It's been.
Yeah, no, I mean, it's not as easy, right? It's difficult because you can imagine everybody's asking for the same test. So we're working with our lab to ensure that we get the right inventory, and we're identifying other sources of inventory and putting those requests in. The idea is like if we get 100 a day, I think that would be sufficient. We're talking hundreds that we would probably need, thousands maybe over time, depending on the influx of patients. I'm sorry? I really do, yes. I think things are loosening up, and I do believe that, and we've got multiple sources, and I do think that will improve over time.
A quick question. First, I want to go back to the testing operation. The city, state, and government is sending mixed messages. On one end, they are stating test, and on another end, we're hearing we don't want to test. We need to be clear on the message. If the message is that we don't want mass testing because we're afraid that people are going to overwhelm the health facilities and the 80% of the people who get coronavirus can ride it out at home, then we need to be clear. We're not clear. So if the message is we don't want mass testing, the worst thing could happen is I open a testing center on Staten Island, and then my residents here are saying why we don't have one here. There's a mixed message coming from the federal, state, and city level. Do we want people to test? And if the question is no, we need to explain why, and we need to be clear. The lack of clarity is leading to the anxiety, and we need to stop it. I think they should. If I have coronavirus and I know I have it and don't have symptoms, then I'm not going home to my mother at 80 years old and exposing her to it. I'm going to self-quarantine myself because it's our senior population, pre-existing condition. That's the population that has a more challenging time of riding through this. I don't subscribe to the belief that we should have as least tests as possible. But if medical experts state that that's the way we should do it, I will fall in line with that. I think the more people know, the better they are to self-quarantine themselves. And the more information we get, the more people are able to be part of the solution and not part of the fear. People are afraid. No, I'm sorry. Did that answer your question? Oh, your question?
Will these kind of facilities be necessary once more tests are available? And can you get details on the other plans to open further tests?
It's always pre-screening is the key, because part of the problem we are afraid of now and in the future is overtaxing our emergency room facilities. So if I can tell you beforehand via telemedicine, via pre-screening, via you testing yourself at home, the more we are able to arm the public to say, you don't have to go into a hospital, you don't have to overtax the emergency room, the better we can deal with those who are in the late stages and need the hospital facilities. So we're going to need this throughout the duration until this crisis concludes. This is the type of pre-screening setup we need for those who need to hear it from the doctor or those who should not be sitting in our emergency room for hours.
Great. Mr. Terrinoni, I have a question. Can you humor me for a minute and walk me through the process? I come in.
Right.
It's determined by a healthcare provider. Can you explain to me who's
Yes.
going to be greeting me?
Right.
What happens if I am identified as having symptoms of COVID-19? Am I getting swabbed? Where does that swab
Right.
go?
This.
Who is
Right.
doing the
Exactly.
testing? Walk me through
Yeah,
that
we're
process.
going to walk through, but I'll just quickly, you're going to walk through it, but there will be somebody in there and you will be separated out, as you will see, but we'll take your information. There will be a healthcare professional that will be taking the swab, and that would be for the testing. And the borough president was really kind of alluding to what we're anticipating. The whole issue here is that what we're trying to do, if you're demonstrating, if you're tested and you're positive, but you're not demonstrating the symptoms, you can more than likely go home. In fact, we're seeing a lot of patients that we're having tested with that come to the ED that present, but then they're allowed to go home and self-quarantine. It's really only, as the borough president is eloquently saying, it's only when those sicker patients that demonstrate, whether it's a fever or they're sicker, they might have comorbidities. Those are the people that we worry about most, because those are the ones that will have to probably be admitted to the hospital, and that's where the bed capacity becomes an issue.
Are you testing on site, or are you sending it out to a private lab?
Yeah, we are
Lab
sending,
testing?
right now we're sending it out to a private lab.
Which lab is that?
It's Quest.
Quest, okay,
Yes.
thank you.
Last
Yeah.
question, Mary.
No, we don't. Because we have a combination of our private institutions and our health and hospital. The mayor announced yesterday that we have an 80% full capacity. We're going to be on a call at 5 p.m. With the mayor to get a briefing. And so we need to monitor this in real time. It's time to get our Dells, our Google, our Microsoft to build a system that we can monitor in real time our supplies, our equipment, our hospital beds, our flow of information. We can't continue to run a city where we have annual reviews or monthly reviews. I'm confused on why we didn't have this already figured out, to be honest with you.
There seems to be a contradiction. Hospital administrators talking about people who test positive and have no symptoms, but you're not being tested.
If you have, go ahead.
If you fit a criteria, there are some people who have no symptoms who fit certain high-risk criteria that are established by the CDC. Those will get tested.
Okay.
I'd like to invite folks in now.